You taking time out of your busy schedule to be here. Um, Again, I'm Joe Gogler from the University of Minnesota. I'm one of the associate directors for the CDRI, and I've been so thrilled to be part of this initiative. And Isabella and Lauren tasked me with talking a little bit about sustainability now that we're approaching the end of the first cohort of these innovative programs that have been supported to advance their work in dementia services and supports, is how do we continue the work? And the way I decided to approach this was really thinking about how do we act on findings. Um, I think oftentimes we approach program evaluation, as an activity we have to do. It's what our funder asks us to do, and a report is written, and then things kind of stop. And how can we take that next step from moving beyond what hopefully presumably will be a really strong, robust, rigorous program evaluation? And I'm sure many of you have a wealth of experience in doing different types of program evaluations. How can that be taken then to really contribute to sustainability? And how can the findings be acted upon to ensure that the innovation that we've established as something that's beneficial and helpful to many interest holders is something that should be continued, and making that case to the key interest holders to do that? That's kind of some of the topics I was hoping we could discuss today. And I'm hoping to do this in an interactive way. You'll see, well, there'll be a couple of exercises through the presentation where I'll ask you to take some minutes to reflect and then share with the group, and versus me just droning on and on over slides. So a resource I think is wonderful. Maybe, and perhaps many of you are very, very familiar with this resource, but if not, the CDC has a really great program evaluation framework action guide. Much of what I've taken out of this, actually all of what I've taken out of this presentation, comes from this guide. It includes a number of wonderful figures, a number of wonderful worksheets, and other tools to really help all kinds of programs engage in program evaluation activities that actually are beneficial and useful, and again, actionable. So if you get these slides, you can just click on that link and access this really wonderful action guide. I certainly refer to it even in my own work as appropriate. So the key aspect of the framework really is this. It's this figure. In the middle, you have a set of core standards that should be adhered to throughout the program evaluation process: relevance and utility, rigor, independence and objectivity, transparency, and ethics. And I'm not going to spend a lot and really time going through each of these, as I think they're fairly self-explanatory. But again, all good program evaluation should aspire to uphold these standards, and no matter what type of evaluation it is. On the outer part of the circle here, you see what are called cross-cutting actions. These are engaging collaboratively, learning from and using insights, and advancing equity. These are actions that really should be embedded and incorporated in each step of program evaluation, of which there are 6. It starts with assess context and ends with act on findings. And, when I was originally asked to pull this together, I started pulling a presentation together that addressed each of these 6 steps. And I got to the 3rd step and I had already had 50 slides, and I thought, well, I better rethink this. So of course I went back to Isabella's original request. She really wanted to focus on sustainability and action. So I thought, instead of going through each of the 6 steps, is focusing on the 6th step, act on findings. But the framework guide actually takes those interested across each of these steps. Assessing context, determining how prepared is a program to undergo program evaluation, who are the key interest holders to identify, how to put a logic model together. All those core aspects of program evaluation are addressed in these earlier steps. But again, in the interest of time, we're going to focus on the 6th step, which is act on findings. This is kind of another representation of the framework, but it shows the 6 different steps. You can see what the different actions are to ensure a robust, strong program evaluation that is actionable. You can see at the bottom there those cross-cutting actions: how to engage collaboratively with interest holders, learn from and use insights at every step of the process, and then advance equity. These are really embedded within each of the steps, which then culminates in step 6, acting on findings and recommendations, presumably to contribute and facilitate sustainability of an innovation that was demonstrated to be beneficial. So we're going to focus on step 6 again. Okay. So there are different types of program evaluations. We often think of program evaluation and we think generally one thing, often outcome evaluation. Was our evaluation beneficial to participants, key interest holders? It could be clients of a respite program, care partners, perhaps even staff. So that's an outcome evaluation. But there are other types of evaluations as well. There are, for example, economic evaluations, which determine the cost ramifications of delivering or implementing a given innovation. There are what are called formative evaluations. These are evaluations that are really designed to design an innovation and to take those initial steps in determining not only what the innovation should look like, but then also perhaps an eventual evaluation of it. There are also what are called process evaluations. Did I deliver the program as intended? What are barriers and facilitators to delivery? I like process evaluations, not only from a programmatic applied perspective, but really from a research perspective as well. When you consider interventions and determining interventions and how they're evaluated to be effective or efficacious in science, often researchers jump immediately to the outcome evaluation. And they don't necessarily report, okay, was the intervention delivered as intended? Did people find the intervention acceptable and feasible who received it? The interventionists or those who were delivering the intervention, did they find it was feasible? What were some of the barriers, facilitators to that? Again, this is process data, but it's data that's very important to not only ensure effective implementation, but also long-term success. Because if we don't know how or why an intervention is delivered, or why that delivery contributes to success, we then have problems with actually ensuring sustainability. And so the type of evaluation that I would argue step 6 falls under is what's called an impact evaluation. This is where we're trying to show that if this program, policy, or innovation was not available, what would have been the outcomes otherwise? Okay. And the goal is to determine whether the activities of the innovation actually contributed to the outcomes. So again, this is often done at the end of a program. It can also be certainly done during operation of a program at certain times. But really, it's really useful for providing evidence to policymakers, payers, other decision makers, where you can demonstrate in compelling fashion, look, if we didn't have this program in place, here's what would happen. Here would be the adverse outcomes. Here would be the potential costs that would happen or occur if we did not have this program in place. Okay. And the program is the reason why we have these positive outcomes. Okay. Again, this all seems self-explanatory, but how often do you see results, outcome evaluations, whatever the program evaluation is, and they don't really answer this question, which is, what is the value really added to this by this program? I mean, what does it really add, and is it really better than what we would do usually? That's what an impact evaluation decides to do, and I would argue it's the type of evaluation that's most conducive to ensuring potential sustainability down the line. So when we think of this 6th step, acting on findings, it really boils down to 3 steps. 1 is planning for use, 2 is preparing findings for use, and 3, facilitating insights to action. What I'd like us to do in our time is to go through each of these steps, think of some key tips, recommendations, and then have you reflect when you consider your own innovation, your own programs. It could certainly be related to the CDRI or even something else. I'm going to ask you to reflect and actually provide us some examples from your own experience, or maybe how you would like to do it otherwise. So planning the findings for use is really designed to answer the following questions. 1, who's going to use these findings? Okay. 2, what data, insights, or recommendations are actually going to be used and emphasized? When are they going to be used, and how will they be used? So we have these findings, we've done an evaluation, impact evaluation or otherwise. Who, what, when, and how are they going to actually, these findings going to be used? Because that, again, will help to ensure dissemination of the findings, and then also discussions related to how we can maintain these results, how these results can be embedded, and how can they be continued as part of our routine yet innovative practice. So here are some strategies, again, coming from the CDC framework.
Knock it off.
Okay. So anyway, here are some of the strategies to encourage evaluation use. First is understanding evaluation at the beginning of the program, and then identifying ways to promote learning and use of evaluation findings throughout the program. So I'm sure many of you are very familiar with quality improvement and other types of approaches such as that. It's really not seeing an evaluation as a pre-post thing where, okay, we're gonna measure or assess something at the beginning of a program, we're gonna do a program, and then we're going to determine the outcome. In the interim, are you collecting different pieces of information, different pieces of data that can help inform, am I or are we delivering the program as effectively as possible? Are we identifying barriers and facilitators to this that might require refinement, might require adaptation, so that we, at least at the very end of the evaluation, we have a program that is optimized, that we know and feel confident is contributing to positive outcomes. That is a key element of when we're encouraging evaluation use. Developing a strong relationship between evaluators as well as the program team, meaning those who are tasked to deliver or implement an innovation, through consistent communication and collaboration. An evaluation process where the evaluation team is basically checking in once every 6 months or quarterly probably isn't very effective, given how challenging practice is, how challenging service delivery is, how it's a very dynamic, changing environment. An evaluation team needs to be aware of that. Facilitating trust with interest holders and program recipients through transparency, engagement, and open communication. Again, we're not spending time on how do you identify interest holders, how do you potentially engage them throughout the evaluation process. That being said, any kind of evaluation must require multiple interest holders around the table where, again, they are plugged in, for lack of a better term, to how the program is not only delivered, but also how it's assessed and evaluated. I mean, we think of many interest holders in our work that are relevant in this regard. Caregivers, clients, potentially, certainly staff, particularly direct care staff, many others that are all involved in this that, probably have key insights when considering, is this program working? If not, why? If so, why? And that should all contribute to the overall impact evaluation. This fourth point is really important when we think of dissemination. Who are the leaders that we know that will champion the use of the evaluation findings? It usually has to extend well beyond the evaluator. Is it the director of the program? Is it someone else in the organization? Is it direct care staff? Is it caregivers who are advocates? Whoever those individuals are, who would be the ones that would champion the use of the findings? And can we craft dissemination products or strategies that are best suited for those particular leaders? Probably how you would disseminate to a caregiving audience is going to be very different than how you disseminate to, say, payers, how you disseminate to policymakers, how you disseminate to researchers, how you disseminate to other staff, directors, et cetera. And then finally, this is lacking in many ways too, and it's something I've been thinking about a lot in my work, which is this idea of evaluation capacity building and team culture receptive to feedback. Maybe we admit it, maybe we don't. Is evaluation really seen as something important to the mission of our organizations? Is it built into our culture? Or is evaluation just seen as an activity that we have to do in order to obtain resources, even for a limited period of time, and then we turn away and that's it? And too often, I think it's been the latter. And there are probably many, many reasons for that. And in some cases, it's the fault of those who do evaluation themselves, in that they're not necessarily aligning the evaluation, the data that's collected, how it's collected, how it's disseminated in ways that also align with the mission, the values of the organizations they're working with as well. So there's this fundamental misalignment of culture. The other point I would make is often when we think of outcomes, whether this relates to CDRI or not, I don't know. And maybe I'm getting on a soapbox, but I think it's an important point. When I think of the landscape of home and community-based services, dementia care, et cetera, is often when we think of outcomes, we think of the outcome in the standpoint of, let's say, a health outcome, a cost outcome on the part of the person living with dementia, maybe a caregiver, in some other instances, maybe a staff person, right? But shouldn't capacity building in and of itself be an outcome? And when I say capacity building an infrastructure that's conducive to evaluation, that's conducive to feedback, that's conducive to actionable information that helps benefit the programs themselves, but then also yields information that's rigorous, transparent, and can really help propel innovation above and beyond a singular program, but then can inform many, many other programs in terms of what they're doing and how. It's a lofty goal, but I think it's something fundamentally missing in the entire science or practice to science or science to practice enterprise, evidence-based practice, where it's thought, well, you do research, that should change and inform practice. We know that is just not the case. The chasm between science and practice and dissemination is vast. And part of the issue may be, are we conducting research and conducting evaluation that fundamentally just isn't usable and is not conducive to the operations and philosophies of the programs we're working with? That's where capacity building would be very, very important. It should be a key outcome in and of itself, but oftentimes funders and others don't always see it that way, and that's unfortunate. Okay, I would like us to start with this first activity. We're just going to do this where all of you can reflect on this. You see that one of the worksheets, planning for action with interest holders. And if you have to, what I like us to do is take a few minutes. You can try to complete maybe one row if more if necessary, or if you can. Think about a dementia care innovation, maybe even think about the dementia respite innovation you're doing as part of the CDRI project or some other innovation. I'd like you to fill out at least part of this worksheet. Who would an interest holder be? A key interest holder you'd want to engage with, the insight that they would be able to provide, or the insight that your evaluation will provide to them. What do you think will be learned? Who do you think will use these findings? And then when will findings be used and how will the findings be used? Try to answer those questions from the perspective of key interest holders in your innovation. You can do one row or multiple rows. So what I like us to do is, how about we take, let's take, how about, what do you think, Isabella, Katie, and others? Is 3 minutes, 5 minutes good?
Yeah, I'd say about 5 minutes should be good.
Okay, why don't we do 5 minutes and then we'll return to this. I'd love to hear what your thoughts are in terms of filling out this worksheet. And you can see here, there are some other definitions that might be helpful in terms of instrumental use, conceptual use, and enlightenment uses. Feel free to incorporate those as relevant. Thanks, everybody, and we'll convene here in 5 minutes. Why don't we take one more minute, everybody, and then love to hear what you came up with. All right. Love to hear what some of your thoughts were. If anyone was willing to share, maybe raise your hand using the Zoom tool or maybe just speak out either way. We'll spend a few minutes on this. Yes, B Mun. I'm sorry, I don't know your first name.
It's okay. Sorry before my dogs were out of control. That was me.
Okay.
Okay, so I am the director of the Office for the Aging here, and so my thought is interested holder would be actually two, which would be the county because we're county funded, and or state too because I have part of the larger New York State Office for the Aging, and family, so like three parts. And hopefully I'm doing this correctly. I think the insight is keeping people, the goal would be to keep people home longer. What I think that would be learned would be that there is a direct correlation between caregivers having a break or a respite and the length of time somebody can remain at home. I think, who do I think can use the findings? I think actually all of the interested holders would be able to, family, county, and state. And who do I, and then when will they be used? Actually, I would use them, well, different, it would be a little bit different. So like for the county and the state, it would be, I would use it during the time that I do my planning for the department as well as my funding. And that kind of goes along with how will the findings be used. But I do think that for a family perspective on having like them realizing that them having a break will then allow them to kind of keep their promise or their expectations with their family, saying that they could stay home longer. And then how will the findings be used? Again, a lot of that's funding and then, just confirming with the family that this is what they wanted. And it's for all of them, the care receiver, the caregiver, and us having our goals of what we want to reach.
Joe, we can't hear you.
Can you hear me now?
Yep, there you are.
Okay, sorry, I don't know what happened there. My apologies. Think about, like, say, for example, for each of the interest holders, let's think a caregiver in that last column. How will the findings be used? Think about how you would share your findings with caregivers. It could be at point of enrollment to your program, you have a flyer that shows the benefits of this innovation that you can then incorporate into marketing efforts, other types of things that would be beneficial and specific to the caregiver, versus you had mentioned the county or some other interest holders. How the findings will be used might be different. Maybe it is an evaluation report, maybe it's something else. I mean, whatever those might be. And I really like this format because it forces you to think, okay, for each of these interest holders, it probably is going to be a little different. What findings will be used, when they'll be applied, how, et cetera. So with that in mind, Lethea, I see you have your hand up. I'd love to hear what you think.
I'm sorry, did you say me? Latina?
Yeah, yes. Oh, I'm sorry. I can't, my eyesight isn't good. I thought
That's okay. I'm used to Letitia.
Yeah,
okay. So I did take it. I have a similar route as Bimun. The interest holder to me would be from my program would be like policymakers and representatives.
Okay, great.
The insight would be the value added services of specifically our organization, Adult Day Health Centers, for individuals with dementia and their caregivers, right?
Okay.
And I
Yep.
also want to let them know how it will save the state money and to prevent to those long institutional care settings, right? What do you think will be learned? Okay, I guess I kind of skipped one. What will be learned is how much money the state can save and how
Okay, good. Good. Yep. Yep.
many benefits it will have for caregivers and seniors who are diagnosed with dementia. Who will use these findings are politicians and state representatives who support the Aging in Place initiatives.
Mm-hmm.
When will the findings be used? I think at congressional forums related to seniors. We have a lot of forums that are happening and related to senior care right now. And then how will the findings be used to determine where to increase budgets and decrease budgets in the support and care of seniors?
Yeah, that's great, Latina. You know, one thing I would add is when you say, who do you think will use these findings? Definitely policymakers. That's who you're targeting. Maybe think of how would you get the findings in the arms, the hands of advocates to get the word out, you know? And those advocates, again, might have very different ideas and will actually very useful insights into, okay, here's what I need to make for me to make the message clear to a policymaker. Because often, like how I think I should interact with a policymaker often is probably very ineffective, whereas they would know. And so how can you take these findings, these compelling findings from your program, get it in the hands of people who can actually make a difference? Sometimes it's not us, it's going to be one of them, right? So yeah, that's great. Wonderful. Well, hopefully you also found this helpful. I always find this, I found this really helpful because this really helps me think about, you know, again, who the interest holders are and how do we get the information to them and when. Let's move on to the next step, if that's okay. Preparing the findings for use. So you've probably heard different examples of, you know, plan, do, act cycles. In this case, data action, rapid feedback cycle considerations. So what this can help you with is, you know, just kind of what we were just discussing about taking and adapting and refining findings and how we present them to give us the best chance to spread the message, disseminate the findings so it can lead to action. And here are some tips on how to maybe do that. So clarifying intent is one. So drafting a short protocol that explains purpose, users, questions that are answered, the low-cost data collection strategies that are utilized, staff roles, you know, et cetera, et cetera. Collect data that's good enough. And this is a good one. This is something I should learn more as a researcher. But, you know, the goal is to collect and analyze data quickly so that it allows for rapid feedback, not just to improving a program vis-a-vis quality improvement, but then also in demonstrating benefits so you can get the word out. Now, this looks a lot different than traditional program evaluations, doesn't it? Where, you know, we're going to evaluate something over 6 months or a year or something like that. I mean, if there are opportunities to collect good enough data quickly and to utilize that in ways that can influence action, maybe even contribute to sustainability, can and should be a goal that we should try to achieve as well. The third is a great one. Again, goes very much against the big bloated white report or final report, is producing a brief memo. What are the major findings? The narrative. What are the stories, visuals? Distribute the memo after the data have been collected and analyzed. Again, you can see what a powerful dissemination tool that would be. I like this next one, engaging and reflective debrief. When thinking of your intended users, some of which you would have listed before in the prior table, center the discussion around questions such as, what are we learning? What are the implications for this project? What actions are required to ensure success? Okay. And then informed by step 4, make decisions to gathering more information before taking an action. Take no action at all or take action, but then make adjustments to the program as well. So in a way, within the context of a larger evaluation, you'd be doing this work to refine your innovation, make it better, and then also still be generating information as to benefit that could be used to inform the dissemination of your innovation. When I say dissemination of innovation, it's basically taking these learnings and package them in a way so people can start telling your story, sharing your story to the key interest holders that maybe we can't reach or aren't as good at reaching. Latina, please. Am I getting it right?
I
I'm not.
apologize, but you got me started. My mind is just wheeling
Great.
over
Well, yeah,
here.
let's hear it. Well, let's do.
Um,
This is great. Yeah, please.
so I have a question for you, Joseph. Do you think it would be
Yeah.
more impactful because of what you're stating? Seems like the interest holders could actually make viable changes. Do you think it would be better if we would include other or data from other agencies like ours that have produced positive outcomes in regards to kind of what we're trying to get them to understand? Did that make
Yeah.
sense?
No, I see what you're saying. So what you're saying is if you find or identify other programs that have done innovative work that have achieved really compelling results, is using that
Absolutely.
information as well,
Yep.
maybe even to inform a decision maker in your organization is we need to do this here. Or to say, to a payer or someone is that we should adopt this as well because look at the results in another place. I think that's compelling. It is. I think that's a good strategy. Um, Keep in mind, I think in the end, depending on the interest holder you're working with and the decision maker, I think I've seen this many times, is using examples outside of our organization are important and effective, particularly to informing our own decision to adopt an innovation. When you're making the case to, get additional funding or get more resources to suggest we need to maintain this program, it adds value in X, Y, Z. Often the best information you can provide, quite frankly, is really your stories, your information, your experience, in a nutshell. Should it be that way necessarily? No, but that I think tends to be the case, If you can bring a client or caregiver to share their story and augment it with actual data and information, that's a pretty powerful 1-2 punch that's local, that people will say, look, oh, wow, individuals in my district are actually benefiting from this. This matters to me. Versus I found out something in state X that's really great. We should do this here, Mr. Representative. What do you think? I mean, you see what I mean? So, great. Okay. All right. So what are some of the ways then to, what are some of the ways then to really incorporate into, I would call it a dissemination product. It's called an evaluation report here. But again, if one decides to do an evaluation report, what should it look like? I'm not going to spend a lot of time on all of this, but for those of you that are tasked to do evaluation reports for your various work, this is basically what the structure should look like. Again, this isn't always the most effective dissemination tool. I wanted to include it more for informational purposes, but again, when you think of what's potentially effective strategies, it's these kinds of things. And these are much different than evaluation reports, aren't they? Dashboards, data visualization. We've seen infographics used very, very effectively. Many organizations, at the Alzheimer's Association is great at this, as is the CDC. Briefs and one-pagers is probably going to be most effective when working with, say, policymakers, perhaps payers as well. I've talked about success stories and how the incorporation of narrative alongside data is a powerful 1-2 punch. And really, to me, sometimes we overemphasize the stories versus data, and then oftentimes we overemphasize the data instead of the story. I think you have to provide both side by side. Because in the end, I think that makes the case for why the innovation is helpful and why it can resonate. And you see many other examples here. We talked about the evaluation report, but all of these are other ways to share and disseminate findings. And quite frankly, as part of an evaluation plan, impact evaluation, an organization should have a dissemination plan as part of that. And I would argue should include all of these different things. Okay. So what should be considered when developing the messages to promote results? Timing first. So when you're going to do it. What is the style? Communication styles can be missed, but really have to be tailored to each audience. Again, we've kind of been talking about this already, but how you make the case to a caregiving audience is much different than how you make the case to, let's say primary care providers, right? Tone of voice and writing, of course, is very essential. This is where it's really important to have an advisory board or lived experience panel of interest holders as part of your overall evaluation process. They could be so helpful for taking, say, a planned tweet, a planned LinkedIn post, a planned memo or flyer. They can review it and give you much better ideas of what the language should look like and how it should read. Who should send the message is important. Okay. Then you see channel, context, where the message will be delivered and the expectations of those who receive the message. These are all important considerations. Okay. I'm sure for many of you, it's probably not new information. But when I went through this, I tried to ask myself this critically, and perhaps you do as well in reflection. Do we really do this well? And do we do this consistently? I often find myself just falling into what's comfortable to me, and I don't do this. I don't change the tone of my messaging. The style doesn't necessarily change for the audience all of the time. And that then leads one to question, well, are you getting the word out? Are you getting the message out in a way, again, that can help lead to maintaining or sustaining your program? If you can't disseminate the findings effectively, you won't sustain your program and you won't maintain it effectively in all likelihood. Okay, so this leads us to our second interactive activity, planning for dissemination for various audiences. So now, based on some of these tips that we went through, I'd love to hear from you. How would you plan to disseminate your innovation? What's the information and purpose of it? Who are the audience? What would be the formats, the messengers, timing? Who would be responsible for doing it? So thinking of your own program, your own innovation, try to fill out a row or two of these. And again, in 5 minutes, we'll hear from you. Okay? All right, everybody. Love to hear what you came up with on this worksheet here. Planning for dissemination for various audiences. Feel free to raise your hand and okay. Latino, please, you're first up here. You had your hand up first. Go for it. Love to hear it.
Okay. So I kind of want your help with this on the last two if I'm not going in the right direction, because this
Okay.
is important to me. For the information and purpose is to convince caregivers. I'm going kind of piggybacking off the same as last time, convincing caregivers that they are not alone in caregiving to enhance the aging in place opportunity. The
Great.
audience will be caregivers and community members. The
Yeah.
possible formats would be in lunch and learn or dinner and discussions, because I've identified that a lot of people like to eat and they'll come and listen
That's
while they
good.
eat.
That's good. Yep.
Okay. Possible messengers are trusted members of the community. For example, pastors, right? In
Oh,
a
that's a good one.
pastoral
Yeah.
setting, right?
Mhm.
Secondly, the timing. The timing to me is now when the topic is hot nationally, right?
Right.
The person responsible, I feel, would be invested organizations who provide essential services for that said population.
Good. I think that's great.
Okay.
Great.
Okay.
Do you find going through this and kind of structuring it is helpful to like think through who would do it
Absolutely.
and when and stuff? That's what I think too. Yeah. That's great. Excellent. Thank you. Anyone else want to give this a shot? Okay, B Mun, please.
Okay, so I hope I'm going in the right way. So information and purpose. So for us, it would be recruiting. I would be the purpose of this one in particular is recruitment for our program
Okay.
with the family. And so the audience would be the family because they're the ones looking for the respite. Possible formats would really be a brochure and a tour of our locations. And then the possible messengers is in their brochure, quotes from other families about how it's been impactful, and then usually a it like we do testimonials too. So if they have somebody that they want to talk to who's in our program to ask them questions, we can do that. And the timing would be during enrollment or possible enrollment into our program, and the responsible person would be our program manager.
All right. Great. That was excellent. Good job. Anyone else? We have our two rock stars that are doing all the contributions. Does anyone else want to give it a shot? Okay. All right. Okay, great. A gift of time.
Oh.
Georgetown, please.
Yeah, I was trying to figure out how to put my hand up.
Okay.
So I agree with everything. That's really, really good. The only thing that I wanted to add would be I'd like to involve my board members as possible messengers.
Good.
Because I think they're really key, and I think that that gets their buy-in, and they have their own kind of circles that they run into. So but everything else would be about the same for me.
Okay, great. Excellent. Thank you. All right, let's move on to the last step here, which is facilitating insights to action. So what are the questions that evaluators can consider when, creating this follow-up plan with interest holders? So what is the support needed to understand and apply the findings? After a team reviews evaluation findings, how much time is needed before we can act on them? I think that's an important one. Kind of what we've just discussed, who's going to champion the findings and recommendations to prevent misuse? And, in research, there's a whole field of research called dissemination research, and it's based on how can information or innovations best be shared and eventually adopted by others, organizations, individuals, et cetera. And, much of our work, if you really think about it, is based on some aspect of dissemination principles. How do we get the message out to get caregivers in our program? How do we share information, or how do we share our innovation to show that it's effective so others will pay for it or others will adopt it, et cetera, et cetera? And so thinking about those key champions is core to dissemination research, like early adopters versus late adopters. Who do you find that are early adopters, and can they champion the message to convince others to adopt what you're doing? Okay. I think this is a core question that is important for reflection. Will the findings have influence? And if not, when one does an evaluation and designing it at the very beginning, how can you ensure that they will be influential? Think about how past evaluations have been used, and particularly how they've been used effectively. Many aren't used at all, or are effectively at all, unfortunately. What kind of data and findings are needed to support decision making? And what kind of data and findings are viewed by leadership as credible? And again, for us, an outcome or finding that's important is, are we reducing caregiving stress, for example? Yeah. Do caregivers, do they have better well-being after they're going through a program, let's say respite? And that's an important outcome. And I think most people would not say it's not important. But in the end, is it sufficient enough for leadership to say, okay, this is a program we want to adopt, we want to support over the long term? Or do you need to consider other outcomes that show, for example, return on investment or value added, those kinds of things, okay? And how will interest holders know afterwards if the evaluation was used as intended? So an evaluation is done. Does it just then sit on a shelf? Is it just then shared with the funder? Or is it actually packaged in such a way so you can share with your interest holders that, look, we did this evaluation, here are the findings, and here's how we used it. Here is our dissemination plan, okay? All right, so that leads us to this final worksheet, which is questions that evaluators can consider when developing a follow-up plan with interest holders. So you see here a bunch of questions. I'll just pick the third one out here randomly. Who will serve as the champion for the findings and recommendations and prevent misuse? That's a pretty good one, misuse, right? We don't always think about, are the findings actually misused in a way that does not advance the mission of our organizations? Who needs to be involved for the evaluation to be influential? And how will interest holders know afterwards if the evaluation was used as intended? So what I would suggest is let's take 5 minutes right before the end of our time here to have you fill this out, and then let's make it 3 minutes so we have time. 3 minutes to fill out, maybe pick one of these or more than one, and then I'd like to hear from you one more time. Okay, so 3 minutes. All right, everyone, for our last exercise, I'd love to hear what you came up with for this particular worksheet. Anyone want to raise their hand and share? Okay, Latina, take it away, please.
I don't know how to feel about this.
That's okay.
Sorry. What the question that stuck out to me is what type of data and findings need to support decision making? With that, I say it's a case by case basis. It depends. To me, it depends on what you're trying to get accomplished, right? And the credible data is data that has proven successes, that has proven to alleviate the barrier that they're trying to overcome or reduce the barrier they're trying to overcome. If they're trying to reduce caregiver burnout, is credible to identify testimonies from caregivers that will show that whatever program that they're trying or whatever information that they're trying to put out there has really enhanced their or reduced their opportunity for burnout.
Great. That's
Okay.
good. Very
Okay.
good. Thank you. Judy, how about you, please?
There you go.
Okay.
Yeah, hi, sorry, my mute
Yeah.
was being stubborn. I was kind of fixated on the, how much time you would need before you act on the findings and recommendations, because I was trying to think of a scenario in which obviously there are things that take longer to implement, but like, why wait at all? Like if you've got important findings, negative or positive, that you
Yeah.
have the ability to implement, why would you wait? I mean, obviously, if there are things that that need to change, then you have to, that take a while. It would be ASAP basically, would be the answer. And help me if I'm missing something here, like,
No, I
because
think,
that just seems
I
sort of,
think,
I don't know.
no, I think the way I like to do is think about who you're conveying the message to and the findings to. I think you're absolutely right, Judy. You find out something works well and you have a dissemination plan in place, at least in terms of products. Okay, how can we get the word out? I mean, how can we share this most effectively? Timing comes into play, I think, because for certain audiences, there may be better times to share than others. I think of policymakers, for example. And I guess this depends. Again, I am not an expert in this, but one would imagine maybe engaging with a policymaker at a time when a key legislative priority is coming up, when they're in session, other things might be a more effective time to share findings in certain ways than others, if that makes sense. So I think it matters. It depends on the audience / interest holder and when you're tailoring those results and for whom.
Yeah, and I guess it's what it depends on what you mean by act, right? Because I'm thinking
Exactly. So certainly
in the program context, right? If you find out something doesn't
exactly. That's
work,
a
why
good
would you
point.
keep doing
I
it?
agree. No, I agree. And I think you saw from the earlier, that's a great point, Judy. And as you saw earlier, I would argue, in fact, in many instances, our program evaluation doesn't allow for immediate action when it should. It should be more adaptive. So, for example, these plan, do, act cycles, quality improvement. If you find something is working and is benefiting somebody, you want to ensure everyone has access to it, regardless of how long the evaluation, regardless of if the evaluation is going to reassess it at 6 months later, and like kind of these static intervals. You're absolutely right in that regard. I'm thinking of action, however, also from the standpoint of dissemination. So let's say you have a program that shows it works. Okay, you've implemented it across your program. You want then to make the case that this program should be maintained and sustained. When and to whom do you share those findings? That to me is the action in this context too. So think of it in both ways. Okay. And then be mum.
So I work in government and everything takes a long time. So if I'm adding to a program or really adding to a program, or even if I'm reducing a program or I'm changing something, I have federal guidelines, I have state guidelines, and I have policies and procedures that I need to follow in order for me to even add things, subtract things to our program. So, obviously, if there was some sort of danger, a policy or something would be easy to do because I have reign over it. But like anything else like that, it just takes time. Takes time for me to, which I know Katie knows all about because she has unfortunately listened to me a lot about our own program and how long it's just taken for me to get things approved because it takes me months because I have resolutions to write. I have to meet the board of legislators and then, get that back and then implementation. So it takes a long time.
So because of that time frame, I would argue it's even more critical to ensure your message is refined and right for the audience, right?
Correct.
In terms of how the program works, for whom it works, how effective it is. Because of that length of time, I would imagine the risk of it not being adopted, not being maintained goes up, unless you have that really strong messaging. So related to a very robust evaluation. So yeah, great points. Let's conclude with Marvin. Marvin, please.
Oh, I just wanted to add two things on the support that would be needed. I always
Yeah.
find, particularly if there's anything quantitative, that there's support for the stakeholders, interest holders to understand what that looks like, because that could be misinterpreted. But I think as we're talking, the more important thing that I think is important, and I think a lot of program evaluations get done, but having a timeline for actually revisiting the evaluation is certainly something that doesn't always, and in my experience, probably rarely gets done. So I think that is a good suggestion to build that in. Like, no, you're not committing to anything at this moment necessarily, but at least have a timeline already in mind for revisiting what the evaluation.
Yeah, Marvin, and this is probably a great way to end our hour because it kind of circles back to something I was talking about earlier about capacity building. Is often evaluations are done where you're getting an evaluator, they're collecting data on their own forms, maybe specifically for the evaluation. They do that over some period of time. They write up a report, and that's it. Okay, maybe the program has been beneficial, maybe not, and then it's left up to the program in terms of how you use those findings. Now, maybe you have some tools after today of how to sharpen that. One of the things I would argue, and it kind of gets to your point, is when we're designing evaluations and conducting evaluations, how important it is, where possible, is to work with organizations that they can continue to collect data and information within their existing operations that are relevant to them, relevant to the program, that can still be collected and used to make the case and show that this program has ongoing benefit well beyond the period of an evaluation, and has potential to be embedded, incorporated in our day-to-day operations in ways that add value. I mean, again, it's easier said than done, don't get me wrong, but that to me should be the goal we aspire to anytime we're doing evaluations, or quite frankly doing research with home and community-based services in the context of dementia care. I mean, that's my feeling.